I'm sorry if I seem to be taking so long to get to my experience of cannabis, but my opinion on the subjects are worthless without a knowledge of the clinical experience that led up to them. After 4 months of internship, I left, but I had had a card up my sleeve all along. I knew there was a shortage of doctors in Saskatchewan and that my qualifications were recognized there. I packed my things into my little car and trundled off over the Rockies and across a flat, wet and windswept prairie to Regina. A few inquiries quickly revealed a post as assistant at Swift Current. I arrived there on July the 1st, 1963. It was known as Speedy Creek by the locals. The annual Frontier Days were in full swing. Everyone was dressed in cow costume, with Stetsons, spring ties, and shiny cowboy boots. I stuck out like a sore thumb. The rodeo, with bucking broncos, Brahma bulls, and all the trimmings, was locally famous. The next day I was taken on at the Swift Current Clinic at $800 a month. The clinic had been started by the elderly senior partner in pioneer days, which were still so recent as to be within living memory. The doctors all practiced as general practitioners, but had specialized interests. The chief had 2 sons, one specialized in medicine and the other in surgery. There were 2 other doctors, one a Canadian whose specialty was anesthetics, and the other one of those ubiquitous British refugees from the National Health Service. The catchment area was extensive. Some patients lived as much as 100 miles away in a different time zone and were generally an hour late for appointments. The other doctors set about putting me through my paces. I was soon taught how to pass endotracheal tubes and administer anesthetics. That none of my patients suffered brain damage was due, I suspect, to the surgeon shouting instructions as we went along. One day the senior partner rang at 7 in the morning to say that Canadian Pacific had asked for a doctor to meet number 1 at 8 o'clock. A passenger had been bitten by a bed bug. I hurriedly shaved, breakfasted, and headed for the station. Dead on time, the train drew in, and I was escorted to the offending compartment. The conductor and attendants were busy biting their nails. They feared I might order the carriage to be shunted off the train for fumigation. Had I been intimidated by the threat of litigation, I might have played safe, thereby creating havoc. But all the patient could produce was a small gnat bite on her forearm. I applied some ointment, and the train pulled out on time. Imagine the relief of the crew. My words would have had the same sedative effect as a shot of morphine. This was the first unusual case of my clinical career. Another day, the old senior partner sent me to visit a couple of his oldest patients. They lived on a farm about 25 miles away. They had been among the pioneers who had first settled at the beginning of the 20th century. The wife, who was not feeling very well, was a kindly little old lady of 88. She had a pain in her tummy that suggested a gallstone. A second opinion was indicated. But at the door, and out of earshot of her husband, she confided that he was 92, but still enjoyed what she called his rights. She said it was a struggle and it took him 15 minutes. She wondered if that could be the cause of her pain. What she really wanted was an excuse to say no, so I gave it to her and the pain disappeared. Such are the subtleties of general practice. I had soon traded my little car for a beefy Pontiac better suited to the prairie than Vancouver suburbs. Swift Current was about 80 miles from the American border in Montana, and I had never visited the United States. One Friday evening after surgery and a hurried meal, I set off. There was little traffic between Swift Current and the United States, so the road was only a graded gravel track. The border closed at 9, and it was necessary to whiz a bit, often at 60 miles an hour. On arrival, the solitary customs officer, who had been idly watching the approaching cloud of dust, walked round the car and pointed to a small hole in the petrol tank. A flying stone had punctured it. He had clearly seen it all before. Then he wanted to see into the boot, or trunk as it's called in those parts. To my horror, I found I had forgotten to leave my bag behind. It was not exactly stuffed with morphine, but it contained numerous dangerous drugs. Before the officer could say anything, I suggested leaving it there and picking it up on the way back, but he just laughed and waved me through. Eventually I came to a town which at first sight looked like a set from a western, but the cowboys did not carry guns, and there was a moderately modern motel. In the morning I found a garage to mend the petrol tank, dreading the expense I thought it would entail. But the mechanic had also seen it all before. He went to the washroom and came back with some soap, which he rubbed over the hole. The dripping stopped. Not only did it stop, it stayed stopped whenever I checked over the following months. The day was spent driving among the bluffs and mesas of Montana down to Great Falls. There was an art gallery full of horsey pictures, but little else. There was no sign of buffalo, deer, or antelope roaming the range, only the occasional squashed skunk in the middle of the road. Here is a snap I took.